Okay, so Assalamu alaikum. Good afternoon, good evening to everyone joining us today. A very, very warm welcome to you from the Institute for Population Health. I'm Dr. Sohaila Chima. I'm the Assistant Dean for the Institute for Population Health and an Associate Professor in Clinical Population Health Sciences here at Weill Cornell, Medicine-Qatar. So again, a very, very warm welcome to all of you joining us today for the Health and You Community Wellness Series. As many of you may know, the overall goal of this series is really to create community awareness about health and disease. And the ultimate objective of the series is to enhance self-care, reduce suffering, improve the quality of life, and increase healthy longevity. So just a reminder, this is not a CME CPD activity. It's for the general public. Some housekeeping rules, we've switched your cameras and microphones off. You can please use the Q&A feature to type questions and comments that you may have. You can also put your questions in the chat feature, and we will be able to see them. So the questions will be addressed at the end of the session. And just a reminder, this is not a CME CPD activity, and no certificates of attendance will be issued. So I think we have a really, really fantastic talk ahead today. So I'm really, really honored to be introducing our speaker for today, and that is Dr. Zahra Naqvi. Dr. Zahra is also, has graduated from Weill Cornell Medicine here in 2014. So a very, very special speaker for us today. And she's speaking on a great topic, I think, which has, there's a lot of interest in this topic. And again, the topics that we do have been told to us by you all, the community. So we try and address those topics. So Dr. Zahra Naqvi is going to talk about anxiety and when your worrying really becomes worrying. So I would like to introduce Dr. Naqvi. She is an assistant professor of psychiatry here at Weill Cornell Medicine in Qatar, and she joined us in January of 2022. And before coming to WCM-Q, she was an assistant professor of psychiatry at Albany Medical Center's Department of Psychiatry, as well as an attending psychiatrist in the Albany Medical Health System. She's board certified in psychiatry. She completed her psychiatry residence training at New York Presbyterian Hospital, Weill Cornell Medical Center in 2018, where she was resident outpatient department chief during her third year. She's an advocate for psychosocial well-being and education in the prevention of mental illness. Dr. Naqvi has participated in the planning of events and advocacy efforts focused on women's mental health with the United Nations and worked directly with the vice chair of the committee on mental health to bring mental health conversations onto the global agenda at the United Nations. She has a special interest in women's mental health, including postpartum depression and other mental health issues unique to women, such as pregnancy loss and infertility. Dr. Naqvi, a very, very warm welcome to you, and over to you.
Thank you so much, Dr. Sohaila, for that warm welcome. And I'm just gonna, without further ado, start sharing my screen. All right, so we're gonna be talking for the next 30 to 45 minutes really about anxiety and when that becomes an issue. Part of anxiety is that in our general lives, we get anxious about certain things, but then when does that really become pathologic or a problem? And that's really what we're going to be focusing on today. To start off, let's talk about what is stress? Now, stress is actually a very common thing that can happen to anybody at any given point in time, and it's really an intrinsic reaction that happens to our body when there is a stressor or a trigger that's being placed in front of us. It can be positive or negative, and our body's response to that trigger or that threat is one of stress. Now, in our common kind of language, we think of stress as, oh, I'm really stressed. I have an upcoming exam if you're a student, or I have a big presentation and I'm becoming stressed about it. or, I'm going in for a job interview, or there's something big happening, like I'm going on a flight to get married, et cetera, et cetera. These are all kind of normal responses to any kind of thing that can be considered uncomfortable, or in our psychological terms, a threat. Now, when we become stressed, there are certain symptoms of what falls under stress. So you can have any of these symptoms, and that would be still deemed appropriate or a normal physiological response. You can suffer from things like frequent headaches. Your sleep could be disturbed. Maybe you're sleeping too much. Maybe you're sleeping too little. You're having different types of back or neck pain. Maybe you're stressed and you're feeling a little bit faint and dizzy or lightheaded. You could have some responses like sweaty palms, or maybe your feet are sweaty. So different physiological responses all can be under this normal umbrella of stress. And when we have these kinds of symptoms, it's important for us to think about, okay, am I responding in an appropriate or inappropriate way? And how we distinguish that, we're going to get to a little bit later. So say you have normal stress. Now we need to figure out, okay, how do we cope with this kind of stress? First things first is knowing how you stress. So if you look at this long list, maybe you suffer from something like muscle tension and poor concentration. And other people in your family might have sleep disturbance and forgetfulness. So different people can have different symptoms emerge at different times. And it's important for us to figure out how we stress to then be able to understand how to cope with it. So first we need to know what our triggers are, and then how to manage these. So say you're getting on a long flight and you know that that's a stressful event for you personally. It's important for you to then know, okay, well, I know that when I get really stressed about flights or going to the airport, I need to sleep, 10, 15 hours in advance, so that when I have those trouble sleeping, it doesn't affect how I'm functioning the next day. Number two, when coping with stress, we usually forget this, but engaging in deep breathing or mindfulness, which is number three, can help us cope with stress. We should practice deep breathing exercises when we're calm, so that when we're under pressure or under a stressful situation, we can then use that same technique and not have to learn it the first time. So deep breathing, we often do this normally, but it's important to engage in it with a conscious idea that this is how I'm going to tackle the stressful situation. So an example would be, okay, I'm about to get on the plane. I know that that's a problematic scenario for me. I'm going to take 2 deep breaths in and 2-4 rules. So 2 seconds for inhale and 4 seconds for outhale. And that's all an important part of how we engage in deep breathing. When we're practicing mindfulness, oftentimes this is kind of thrown out there in our common language, which is, oh, we should really be mindful of our surroundings, how we're thinking about those around us, our environment, how we're interacting with society, et cetera, et cetera. But there's an actual very active way to engage in mindfulness. There's a lot of apps out there that are able to help you coach yourself in practicing mindful behaviors. But a common way or an easy way is to keep a journal. So some people really learn by writing, and oftentimes really benefit from starting the day off by what happened the day before, or ending the day with what happened the day that just passed, to help ground them in what they achieved, what they can work on, and keeping that journal on a daily basis. Other ways that people practice mindfulness, cooking, going on walks, and being really mindful of being in the environment that they're in. And this is something that actually has come up often for both patients and friends, that when you're coloring, it actually is an artistic release of maybe some of the stress that you're going through, and can be actually very grounding and a grounding experience. So that's always something that we can think about when we're practicing mindfulness. Okay, so we've talked a little bit about, what is stress? And again, stress is a natural, normal response to any kind of perceived threat or trigger. Now we're going to move towards, what is anxiety, and how does anxiety really differ from stress? So anxiety is actually a sustained mental health issue that can be triggered by stress. So it's different, but it's kind of maybe a consequence to think of, or a secondary issue that can emerge from stress. Anxiety doesn't fade away once the threat is in the past. So for example, you're stressed about your flight. And I'm using this example just so we have a thread during this talk. So you're anxious, you're stressed about your flight. The flight is over, you land at your destination, you get your luggage and you leave the airport. Your stress should resolve itself. You're no longer under that scenario. But if you're somebody who suffers from anxiety, sometimes your feelings, those sweaty palms and feet, the headaches, the trouble sleeping, doesn't really go away once that trigger is gone or eliminated. You continuously have that heightened sense of fear or worry. And anxiety, lastly, can cause significant impairment in social, occupational, and other areas of living. So that's an important distinguishing factor, in that anxiety really becomes something that prevents you from living your life the way that you want to. And that's one of the reasons why it's a problem, because it impairs your functioning to some degree. And that's when your worry or your stress becomes something much bigger. And we'll talk a little bit about how to tackle that. Okay, so we talked a little bit about what symptoms are for regular stress. Now, what are the symptoms of anxiety? So one of the major symptoms is that you have difficulty controlling your own worry. So if you're thinking about something and you can't get that thought out of your head, no matter how much you distract yourself. So we talked a little bit about mindfulness and grounding yourself by doing things like walking or coloring or journaling. Those techniques aren't helpful, or not helpful to such a degree when you're suffering from anxiety. You have difficulty maintaining thinking about other things or distracting yourself from your stress. Symptoms of anxiety can include restlessness or feeling keyed up or on edge. So you feel like something's going, like your brain is either on a motor or you're physically quite uneasy. You find yourself easily fatigued, have difficulty concentrating. Sometimes people find that their mood is changing. So they can be irritable or sad, or become really energetic or hyper. Muscle tension, sleep changes, exaggerated responses to normal kind of stimuli. So an exaggerated response to the bell ringing or somebody knocking on the door beyond what would be considered a normal response. Somatic symptoms or physical body symptoms like headaches, stomach aches, dizziness, and then other things like shortness of breath, rapid heartbeat, excessive sweating, chest pain. These can all be symptoms of anxiety. And I really want everyone to kind of understand that anxiety can present in two different ways. There can be physical symptoms of anxiety, the ones that we kind of talked about just now. So like physical pain, like headaches or stomach aches, shortness of breath, your heart beating faster, sweating more than often. Physical symptoms, and then there can be mental symptoms of anxiety as well. And those are kind of like your brain kind of working on overdrive or excessively. And those are in two different categories. You can have symptoms from both, but it's important for us to distinguish the two. All right. Now, what are the differences, the key differences between anxiety and stress? So although many symptoms we're talking about are similar, stress is typically transient, while anxiety is of a longer duration. And what that really means is stress lasts for the duration of the trigger, or maybe less so as your body adapts, but anxiety lasts far beyond the trigger. Anxiety causes clinically significant distress or impairment in social, occupational, or other areas of functioning. We mentioned that. So if you're so anxious about getting on the flight, maybe you never get on the plane and you don't ever get a chance to visit family or relatives in a different country. And that really impairs your social functioning. So that's an example of when your anxiety becomes so overwhelming or uncontrollable that it affects how you function socially, for example. Anxiety is also among the most common mental health issue in the US. I'm not sure of the data here in Qatar, but I'm sure it would be similar. But it affects over 40 million adults in the US. And that I think is an underestimate as opposed to what is probably we see in our day-to-day lives. All right, so what kind of causes can there be to anxiety? So there are actually some medical causes of anxiety. So some people who have cardiovascular problems, so heart issues, can suffer from anxiety, asthma, seizures, diabetes, specifically hypoglycemia, hyper or hypothyroidism or different thyroid function issues. Certain medications can cause anxiety, and substance use or drug use can also, both legal and illegal, which that means prescribed or unprescribed medications or drugs can all be causes of anxiety. What intrinsic possible causes are there of anxiety? So generally, our personalities and our characters differ from person to person. I could be very different from my siblings, from my children, from my parents. And there's some internal traits that can predispose us to maybe becoming more so exposed to developing an anxious personality. So having perfectionistic traits, so people who are really focused on making everything as perfect as possible. Internally, having a tendency to overreact to situations. Those of us who suffer from maybe low self-esteem or being extremely sensitive to criticism. Having internal kind of higher expectations for ourselves or for those around us. Those of us who kind of engage in obsessive thinking or often thinking or ruminating about something over and over. Those of us who have a general need or tendency to worry about our health or wanting to appear in control of things, all can be general tendencies that predispose us to developing anxiety. And the reason I mention this is it's important for us to self-reflect a little bit, to think about, do I fall under this category? Or is this something that maybe I have within me that should make me aware when I'm responding to situations, oh, I should have a better handle on this? Or is this something that I can work on? All right, so what are the common fears that are associated with anxiety? Now, the number one fear that I hear as a clinician from patients is whenever a patient is endorsing a feeling of anxiety, oftentimes they'll say to me, oh, in that moment, I felt like I was going to die or that I was dying. And that's why I was so anxious. So dying is actually a very common fear that's associated with anxiety. If I get on that plane, I'm going to die, for example. Oftentimes the anxiety can be so overwhelming that you feel like, oh my goodness, I'm going crazy or I'm going to go insane worrying about this situation. People who have physical symptoms of anxiety, often because they develop shortness of breath or palpitations or chest pain, oftentimes fear that they're having a heart attack. And a lot of times patients will end up in the emergency room being seen by a physician because they were worried they were having anxiety or more commonly panic symptoms, which we'll talk about a little bit later. Other fears include fainting, losing your breath, losing control, embarrassing oneself, choking. So all of these very real fears kind of emerge when you talk to somebody who deals with anxiety. Now, I just wanted to take a quick step back and talk a little bit about what is the fight or flight phenomenon. And so in fight or flight, this is actually an important terminology that emerged when we thought about what is, our body's normal response to a threat. So for example, back during the caveman days, if we saw a tiger or a lion in the jungle or a snake, our body would prepare itself to either fight or run away, flight from the situation. And in that moment, our body kind of really releases high levels of things called adrenaline, hormones such as cortisol, to prepare this kind of physical reaction that we need to either choose to fight the threat or run away. It can cause our heart to beat faster, our blood pressure to rise, our breathing to be faster and more shallow. So all of those physical symptoms that I was talking about earlier. And the purpose is, again, to prepare the body to fight the threat or flee, run away. It's actually very useful when confronting a real physical threat. So for example, when there's a burning building and you have to react quickly, like I need to run out of this building, you need those extra hormones to help propel your body out of the situation. But it's not really appropriate for non-physical threats. So for example, if you're very nervous about giving a presentation, like public speaking, and you've got all of these pent-up hormones, and your heart is beating faster and your blood pressure is rising and you're breathing faster, that's not really a good or an appropriate response to that kind of stressor. So this is where we see the change in what was normal physiological response and what is pathologic. All right. Common anxiety disorders and how to tackle them. So common anxiety disorder. So anxiety is actually a very big umbrella, and below it, we have a lot of diagnoses or disorders. So anxiety disorders in general can be, anxiety disorders. There's specific disorders like social phobia, when you're worried about specific social or gatherings or environments. Panic disorder, we're going to talk a little bit about this. Post-traumatic stress disorder. It's not, it was not well studied until the world wars, and then became part of our general language on how we understand when somebody's in a traumatic situation, how their body responds. And now PTSD, which is what this term is, post-traumatic stress disorder, has become very much part of how we think about trauma and our body's response. Then generalized anxiety as well. Okay, we're going to talk about how to navigate these. So the first thing we do is think about, how am I thinking in this situation? What's my thought process? Am I thinking if I give this speech, I'm going to die? Am I thinking like I need to be perfect during this speech and that's the only way I'm going to get through it, or I can't have any room for error, et cetera, et cetera. So we have to think about what's our internal monologue. When you realize that you are suffering from anxiety, the important thing is to ask for referrals, to be seen by somebody who specializes in this, or at least has some knowledge about this, rather than ourselves going on to the internet and Googling whatever might come up. One of the reasons we find often people don't see physicians or clinicians is because they're really worried what other people are going to think about their anxiety or about their symptoms. And so really managing that stigma associated with having these kind of issues. Educating ourselves about what we can do, things like self-care, sleeping right, eating right, health, diet, exercise, all of those things. And then again, using a preventive focus. So if we know we have a propensity to become anxious, using things to kind of prevent that before the anxiety sets in. Okay, so first of all, how to start thinking about panic symptoms. Now, I wanted to spend a little time about what really panic is. Anxiety in general, when it becomes heightened by 10 hundredths of a degree, just pulled up a whole bunch, we get what is called panic or panic disorder, when you have a panic attack. So what it is exactly is a heightened physical sense of your heart beating faster, shortness of breath, sweating, palpitations, all of those things, but then also a mental aspect of an impending sense of doom, like I will, the worst possible outcome is going to happen. And that, when you have that, is called a panic attack. And if you have multiple of those in a certain time period, it becomes panic disorder. So what to think about when you're thinking about panic symptoms? First of all, you have to recognize that you're feeling anxious. So first point is to identify that this is happening. Give yourself permission to feel anxious. One of the things that we tell our patients is float with it, don't fight it. So if you notice that your anxiety is creeping in, instead of trying to get your mind off of it, allow yourself to feel that fully, because sometimes distracting yourself from something can make you think about it even more. Breathe, so deep breathing, again, that 2-4 breathing that I talked about. Using positive self-talk statement. So that's okay. You can give the speech. Nothing bad will happen if you make a mistake. You can only do your best, kind of using those positive statements. Burn off that nervous energy that gets pent up often when we become stressed or anxious. So things like taking a walk, listening to music, cooking, kind of something physical to get us away from thinking so heavily about that negative event. And then try to find out what is it that's really bothering you. So really think about what is the trigger. Is it really giving the speech? Is it talking in front of 15 people? Is it problems with the mic? Is it going to be anxiety about the topic or answering questions? Like, what part of the thing is bothering you? And to really understand that, because then you can really focus your efforts on that one specific thing. All right, so anxiety, like I mentioned, is something that is very common. How does a person really cope with anxiety? And that's an important question for us to think about. So counseling is often very helpful in helping people identify triggers and develop coping skills. Counseling is something that not everyone can do. So it's not like talking to your family member. Counseling is actually a very important aspect of psychological well-being and requires you really to speak to someone who knows how to counsel so that they can help you in the right ways. And so it's important for you to identify those people in your life or professionals. Medication is also a very common treatment for anxiety. There are specific medications that have been shown to be helpful. And those are given based on the severity of your symptoms, the kind of anxiety you suffer from, and under the purview of a physician. So definitely when you're seeking help, your physician would be better able to counsel you on whether or not medications are necessary or not. And oftentimes, research has shown us that people benefit from a combination of the two. So both therapy or counseling and medication. Those two go hand in hand. And although people can do really well with therapy alone and with medications alone, the people who do the best often have used the two together. So a synergy of both. I mentioned a little bit about positive versus negative self-talk earlier, and I wanted to really expand on that because this is a talk geared towards the general public, and I really want you guys to be able to learn how to use these techniques in your day-to-day life. So negative thoughts are feelings, obviously, that make us feel down, bad, angry, scared, those general feelings that our mind creates for us in response to different situations. Whereas positive thoughts are comforting, reassuring, uplifting, realistic, but not rose-colored. So I really wanted to identify this. Something that is positive doesn't mean that it has to mean the best. Positive has to still be in the realm of realistic. So you can't say my talk, a positive self-talk would not be, I'm going to give the best presentation ever. And that's probably not realistic. Your presentation won't be perfect. You might mess up a couple of slides. You might stump yourself on a question. Something might go wrong. So be realistic in when you're coming up with positive affirmations for yourself. For example, I'm going to give the best talk I can give in this situation. And that's a realistic goal for you to have. So negative thinking in general is a bad habit that contributes to anxiety. Negative thinking can be anywhere from I'm so stupid I got 5 questions wrong on the exam, or I'm so unprepared I couldn't answer the question correctly when they asked me during my presentation, or I'm such a bad person because I couldn't get on the plane to visit my mother when she was sick. These are all bad habits that we create for ourselves when we involve negative self-talk. What can we do to change our thinking? So the first thing is catch ourselves when we're having a negative thought. Challenge the validity of that negative thought. So really say, am I really a bad person if I can't answer a question correctly during a talk? Or is it just that I didn't have enough knowledge on that specific issue? And if I did, I would be able to better express my feelings. And then replace that negative thought with something positive. So say you did mess up a question on an exam. Say, you know what, I really didn't do that question right, but I got so many other questions correct. So to replace something negative with something positive is an important way on how we can change our thinking. One of the things we teach our patients and anyone really is we can only really control the controllable. I can't control traffic, especially not in Doha. I can't control the weather, especially not in Doha. I can't control the economy. I can't control world events, globalization, technology, attitudes of other people. Those are out of my control. What can I control? I can control my attitude, so my own feelings and my presentation of those feelings, my behavior, how I interact with others, and my own actions. Those are things I can control. So if I can't control the traffic, is it really worth me getting anxious about driving to work if I can't control what other people are doing on the road? Probably not. What I can control is next time somebody cuts me off in traffic, I'm going to take a deep breath and keep going. So you can control only what you can control, and the rest is not possible. Now, this is a common trap or a thinking trap people fall into when they become quite anxious. They go into the what if thinking. So what if thinking is really, well, what if something bad happens? What if I get in my car and something bad happens? What if I get into an accident? Much of what we're worrying about actually never comes true. We are getting worried thinking about what might happen. And, it might happen, but most likely it won't. So our fears of the situation are often much, much, much worse than the situation itself. So getting into your car and driving is fairly low risk, but we often worry, oh, what if I get into my car and I reverse and I hit a tree and then I get onto the road and I'm speeding and et cetera, et cetera. And we catastrophize the situation in our mind. So try, instead of worrying of what if or what might happen, try and anticipating what can happen in a positive way, with a positive outcome. So instead of saying, what if I get into an accident, say, oh, what if I see a beautiful sunset on my drive home from work? So you can change that what if statement from a negative statement, what if I get into an accident, into a positive statement, like, what if I see a beautiful sunset on my way home from work, for example. All right. So one of the things I talked about was how medications and therapy and counseling can all kind of go together and help somebody think more clearly about the situation. Now, we notice not only here, but everywhere in the world, that there are barriers to accessing therapy or counseling for anxiety. Even when counseling services are provided and are available, not everyone takes advantage of these. And so there was a study that was done about what really was going on that was identified as a barrier for counseling. And they found out a significant portion of people are worried, well, what will the doctor write in my health record or in my document, and when, where, and who will see that? Will it be kept confidential? Will my employer see it? Will my job know? Will my family know, et cetera, et cetera? So this lack of confidentiality really was one of the barriers for seeking help. The stigma was the biggest barrier. I don't have a problem. I don't have an issue, so I don't even want to see a physician about this or a clinician about this. I can handle this on my own. I'm strong. I'll just do some extra kind of time with myself, and I'll prepare extra, and I can handle this on my own. Some people don't access counseling because they don't feel like they have the time to go see a therapist or spend time with a therapist about what's going on. And then the last thing really is cost. It can often be quite financially draining, seeking treatment. These same things were identified when you think about medications and why people who suffer from anxiety don't want to choose medication as an option. Now, when we think about how anxiety is diagnosed, it often requires you to see a physician who then asks you a series of questions. Different questionnaires are for different groups of people and different issues. And those questionnaires are kind of completed and compiled, and then your physician will take what is called a history, which means they kind of start you from point A and until the day that you showed up in their office and ask you, what's really been bothering you and what's been going on. And once they have that history, they'll take your past history to see if there's any medical conditions that can be contributing to how you're feeling. And then any family issues, any social issues, any financial issues, basically get a very general understanding, and then really dive deep into different aspects of who makes you who you are, or what makes you who you are, to understand maybe what they can offer in terms of help. Once they do that, they come up with an idea of, okay, maybe you need a combination of medications and therapy, maybe just therapy alone, maybe just medications alone, et cetera, et cetera. And that really is a conversation. So it's not your doctor saying, Mr. X, you need this and this. It's really, these are the things that I think could help. What do you think? And then that becomes a dialogue between yourself and the physician. And that's an important aspect of treatment, is for you to feel like your treatment is helpful or beneficial to you. And so it's always important to express, what you're worried about, what your internal barriers are to seeking help, and what we can do to overcome them. Okay, so this is what, things can happen to help you. But what can you do to help? Especially in a society like here, where we often see people might be suffering and want to help them. So first of all, accepting the idea that meaningful change is not easy. So this isn't going to be easy. If you find yourself suffering from things like anxiety, creating an environment that helps you or helps you fight the anxiety is not easy. And it requires a lot of time, effort, mental help, a lot of those things. It requires a cultural shift from us, also identifying, oh, that person suffers from a mental health issue. Oh, that person has anxiety disorder. From that, moving away from that being a negative thing, being something positive, like, oh, this person is invested in helping them be the best person they can be. They're really investing time and effort and money into helping them think as clearly as they want to, so that they can be there for their family, their friends, their employers, employees, whatever. 56%, and this is like an underestimate, I think, of depressed or anxious individuals fear losing respect of those around them. So it's important for us, if we know that someone is struggling, is to treat them in the best way that we can. 83% of people who suffer from anxiety often fear that others would view them as unfit. So if someone says to you, I'm suffering from anxiety, oftentimes they worry that you're going to think of them as ill or unfit to do a job. And it's important for us to change that as a society and as a community. Always approaching each other with empathy and understanding is of paramount importance, and referring concerns to those close to the individual. So if you really are worried about somebody, to identify those that are part of their support system and say to them, I think, Mr. X, Y, and Z, or Miss, ABC is really suffering, and I wonder if there's anything we can do to help. So that's really my talk, very quickly, about anxiety and worrying, and I'm open.
But again, thank you so much, for this fantastic talk. I'm sure many people have benefited from it. So we are really, really grateful to you, Dr. Naqvi, for having taken the time out, for giving this talk today for our community. We are also